At this point, we'll be looking at the psychology of pandemics, all the fears, rumor-mongering, fake news and superstition associated with the ongoing contagion. And to help us talk about that is Ada Osomonika, Chief Executive Officer of Maid K Health, a company that provides public health and psychological support solutions and interventions. She's also a public speaker, author, coach, trainer, and a TV show host, The Mind Doctor. Welcome to the program. Good morning.
Monica, thank you for joining us on the morning show. Well, let's go straight to business. COVID-19 is the big problem that we all face in the world today. And a lot of people are being asked to self-isolate or distance themselves from others or even just stay at home. And a big part of that challenge is the psychological pressure that it imposes on individuals. What kind of coping mechanisms do you think that people can adopt at this time?
Okay, very good question. The first thing to think about, what I recommend is that let's all understand that this is a new situation. It's a new kind of normal that we're now addressing. So staying at home, being told to stay at home or being told to self-isolate is for our own good in the first place. When we're home, for example, in fact, it's such a funny experience now because people are beginning to discover that a lot of people who never spend time at home are suddenly have to sit in the same house with their wives or sit in the same house with their children. But I suggest that when you're home, start taking up exercises, start taking up, read a book, stream a show, things that would help you actually relax. Control the amount of information you're taking in from outside because there's a lot of irresponsible information going out there that is not actually productive or positive about the situation. So control the amount of information you're taking in because as you're taking in this kind of information, it's turning into a state of fear and panic. So while you're home, find positive things to do. Find ways to engage with your family. People are discovering now that maybe family members they haven't spoken to in a long time. I think one of the governors in the States was talking about that he ended up having a conversation with his daughter, which he hadn't had in a long time. So those kind of things, have those conversations with family members, with friends, connect again with people through a new normal way, via social media, if you guys happen to be in the same home together, connect more. That's one of the coping mechanisms, yeah.
Thank you. But what about maladaptive behavior that some of us are witnessing and a lot more of us are actually displaying in trying to cope? You mentioned social media. People are on social media reading all kinds of reports, which are creating anxiety and all kinds of stress hormones. It's making people aggressive, short-tempered. Yesterday, like Dr. Abati was saying earlier, a person in my nerves were completely shredded because in this job, we don't have the liberty of avoiding certain things. We consume a lot of information and you're reading horrible projections, doom and gloom. What do you do to create a buffer so that you don't, lose your mind?
Oh, yeah, exactly. Okay, the psychology of pandemics. Pandemics are largely controlled by how we behave, how the people in that situation behave. One of the things we have to understand is that if we want this pandemic to get out of control, we have to disobey. Then generally we should not disobey everything that we're being told. But if we want this pandemic to stay in control, everybody has to comply, do what you need to do. Now, about the buffer, right? Now you're taking in a whole lot of information, especially people like you that are in this kind of space. You cannot avoid the information. What do you do now when you step away? For example, you're not in the office 24 hours, or those times that you're not listening to all that information that is being, targeted your way. Go back to a certain space and kind of like decompress. You have to take time to calm your thoughts. This is the time to practice relaxation techniques. This is the time to practice mindfulness exercises. This is the time to actually begin to think of what you're thinking about. If you follow, I'll give you an example. If you're streaming through, if you're looking at your Instagram, timeline, for example, if you keep at it, keep going, before you know it, you're like, whether you like it or not, you start panicking. You start thinking, okay, what if this is here? I mean, yesterday I heard about somebody that I actually know who's in the States, who's gotten it. It's so easy to now get into that thought pattern. Oh, if you could get it, oh, that means anybody can get, you know. But how is that thought process going to help me? You need to like lock up those kind of thoughts. In our brains, we have what you call the part of the brain that feels and the part of the brain that rationalizes. If you allow yourself to take in so much of this information with no way of, you know, letting it go or with no way of decompressing, your feeling brain is going to take over and your rational thinking brain is not going to, you know, it's not going to work. I mean, statistics we're having, despite the fact that it's over, as of today, over 300,000 people have been affected by the virus. But there's over 100,000 people have recovered. You know, let's try to look at the positives of this and how much we can learn. I mean, governments are beginning to realize that, oh, they don't have, you know, proper health care. They don't have this, they don't have that. And people are stepping up to see what they can do to address the situation. I think if we begin to look at the positives that this situation can bring to us and de-emphasize so much of the negative, I think it would help us more, yeah.
I mean, government is talking about a number of measures, and government at all levels has also introduced a number of measures, including recalling from retirement doctors and nurses. Will you also recommend to government to perhaps set up counseling centers for people who may need counsel, who may need empathy at this time, considering the fact that when people are forced to self-isolate, it could have implications for their mental health?
This pandemic is a peculiar situation. Yes, it requires public health officials stepping in, doctors, nurses and all that, but it also requires a mental health support approach as well. Yes, I totally agree. Counselors should be, you know, brought in, mental health counselors, psychiatrists, psychologists, because people are really, really dealing. People who haven't even been infected. People who haven't even gone into those areas are dealing with the panic, let alone those who are infected by the disease, having to think about it, having to, I mean, hearing what they're hearing. I heard today there was a family who just sat down to dinner together and about 11 of them died because they all got the disease. So you can imagine what's happening to the other family members, how much they're struggling with their own emotions, struggling with their grief. Yes, I agree that, yes, we should work together, public health, mental health, side by side, addressing this crisis.
Yeah, let's talk about what we've seen with regards to hoarding of essential items. And unfortunately, it's been condemned, but unfortunately, that's the thin end of the wedge. That is panic buying, as they're calling it. The other extreme of that is demonstrated when there are riots. In every pandemic that I've ever read of, from Ebola all the way to the plague, there's always some kind of deadly riot. With Ebola, I remember distinctly a West Point, a neighborhood in Monrovia. The government failed to communicate accurately. The people of that neighborhood woke up and they were barricaded. It was an imposed quarantine, which I guess every quarantine is imposed unless you're self-isolating. But nothing was explained to them. 70,000 people woke up and found themselves barricaded, and they felt that because they're poor, they've been condemned to die with predictable results. There was a riot, and there was a picture of a 16-year-old that was shot in the leg by one of the soldiers, laying on the floor shot and crying, and nobody would help him. He died. So all of those images, I'm sorry, that's what I was thinking about all weekend until yesterday. And it's really worrying. Already, we only have 40 cases. That's 40 cases too many. Well, 37 active cases. That's 40 cases too many. We shouldn't have had any, ideally. But already we're seeing panic being exhibited. What needs to happen at this point to bring calm and control?
The government has to step in, even if, well, we can't say things like declaring the army stepping in or anything like that. But I believe the government has to also take a very forceful step over that. Not just providing health care for people who need it, but this aspect of knowing what can happen when people hear that, oh, you know, there was a rumor going around that, oh God, the market might be shutting down. So people are panicking, and people are selling at exorbitant prices, and people are doing all kinds of things. I think also the government should address that aspect as well. What can be done? The law enforcement agencies in the different areas, in the slums, for example, where something like that can easily just lead, you know, into very unscrupulous behavior. They need to be able to send out, equip the law enforcement agents and let them know how to handle situations like this, a crisis like this. I think we need to like approach this this is a new virus, a new, I mean, it's Ebola. We know what we went through with Ebola, but coronavirus is slightly, it's a bit more, you know, it's like it can just go just like that. The panic is more, you know. So I think the government has to like not just be addressing the fact of the healthcare and what we need, but even also this other approach of keeping people in check, letting people know that if certain things are done, you could be arrested, you could be, you know, you could go to jail. Such things are not allowed. This kind of behavior, in fact, the kind of language they should be putting out in the media, such things will not be tolerated. Hoarding, you know, violence, robbery, all these things need to be communicated, you know, and communicated, and also not just like areas where all the slums, for example. People don't need to be, we need to still be, you know, have concern about each other. We shouldn't just feel as if the guys are in the slums, we can just go there and then just shove everybody, you know, up in somewhere and then, you know, like what you were describing in that situation, that was really, really wrong, you know, putting people in that kind of situation, not even telling them what is happening to them. It can only lead to a worse situation. As we're handling the coronavirus, we should also understand that there are certain things that we can do that leads to more problems than the virus itself. You know, so I think we have to like have a very, very holistic approach to handling this matter. Yeah.
Well, Osomonika, brilliant thoughts there, but we'll take a short break now. When we return, the conversation will continue. Please stay with us. Welcome back to the morning show here on Arise News. Still with us in our Lagos studio is Osomonika, Chief Executive Officer of Mid-K Health, a company that provides public health and psychological support solutions and interventions. And we've been having a conversation with Osomonika about the psychology of pandemics. Now, there's been a lot of talk around COVID-19 about stigmatization, about xenophobia. And, you know, this has a lot of effect. And you just said before we went on break that there are certain things that you can do that can create more problems while you are trying to solve a particular targeted problem. What are your thoughts on the conversation around xenophobia, stigmatization, and particularly the Nigerian government now threatening to release a list of names of persons who may have refused to self-isolate or surrender for testing?
Wow, that's deep, you know. But from what I heard earlier, also that there are about 3,000 people or more who haven't, you know, come forward to say, you know, to say that they've been exposed to COVID-19. Well, going as far as releasing names, I can't say government should or should not, you know. But I just feel that some of these things, if, for example, now let's look at a scenario like this, if they release the names, you know, and maybe, look at it, and maybe you've been in your own neighborhood, maybe your estate, you're thinking, you know, that I'm safe here, everything is okay here, and they suddenly release the names and you saw the name of your neighbor. What kind of emotion would run through you? You'd be like filled with rage and probably go and, you know, if it was the States, probably go and shoot the guy. Just how can you come here and expose all of us? You know, so I tend to think of this is a little, if they have the names, isn't there a way of tracking these people down? You know, aside from announcing, you know, for people to suddenly now do jungle justice and then go in and bring them out, you know, I think that would have to happen if we have really reached extremes. But right now, I think there should be options of tracking these people down. If we have the names, we have the addresses? Do we have any way to, locate them, so that we can send out officials to go and bring them in? That's what bring them in. This is not a choice of them to like, oh, I just want to stay back, Bring them in so that we don't have a jungle justice situation going on where you're bringing out the names and somebody who sees his enemy's name on the list suddenly now looks for a reason to start a fight that has nothing to do with COVID-19. So I think there should be a way in our country where we can track down these people and get officials to bring them in.
Well, I hope they all gave the correct information and it doesn't come to that. But a lot has been said about COVID-19 affecting those with pre-existing medical conditions and taking their cases from mild to critical. But what about those with pre-existing mental health conditions? What advice do you have for them at a time such as this?
At a time such as this, it's very, very important that they are in touch with their psychiatrist or psychologist going through this kind of disease. You need to, even if you're not physically meeting, but be on, online is now the thing, talk to your psychiatrist, talk to your psychologist to make sure that your mental health is in check even when you're going through stuff like this. Now, maybe if I understand your question more, it would be maybe, for example, somebody who had schizophrenia, for example, happened to get COVID-19, wow, that would be, an intense situation. And he would need as much mental health support as possible, because somebody who's not even experiencing mental health issues would still panic. You talked about what you were going through yesterday. So I think they need to have their mental health support, their psychiatrist or their psychologist, with them, counseling them, either online, physical, and either way. But they need that kind of support at this time. Yeah.
Still on that line, what kind of advice do you have for hypochondriacs, these persons who worry excessively about their health, even when they've not been, infected and they've not, exhibited any symptoms? They are perpetually anxious. Don't touch that. Hey, don't hold that. I see some of those people around me, but, that in itself looks like a problem because, you don't have any symptoms, you don't have any issue, but yet you are panicking. You are panicking. I know many people who have been going to hospital seeking advice. We've all become doctors, and some people are experts. What do you say to those people who are over-worrying about their health?
If you are over-worrying, I suggest that you see a psychologist. Because what is happening to you is actually not normal. You're not meant to be in a state where you are constantly obsessed with thoughts that are distorting your brain. Now, for example, let me even say it how dangerous this can be. If there's a high level of stress right now, cortisol, adrenaline, everybody is heightened. Any little thing, someone could just say something just maybe slightly unkind to you, and the way you would flare up at that person is really not about that person or even you. It's just generally what is happening in the atmosphere right now. There's a lot of uncertainty. People don't know whether they're going to have a job tomorrow. Nobody knows how they're going to survive. Countries are giving out money just to ease that pain and that fear and that worry of how am I going to survive? So talk less. That kind of situation even has. This is what the stress can do to someone. Stress is connected to loss of memory, worse mental issues, heart disease. It actually triggers all those kind of reactions. That is not what we want to achieve. Any hypochondriac who already has issues, over worrying about their health, needs to locate a mental health specialist and talk with them. Now is the time to realize that this is not a normal condition, and now coupled with a pandemic, his or her emotions will be totally out of control. They need to see a psychiatrist, psychologist, they need to see a mental health specialist urgently. Yeah.
I don't have pre-existing mental health issues and I'm not a hypochondriac, but I literally cannot tolerate a pinch of negativity right now. I really can't take it, honestly. So I totally agree with you. Let's talk about another aspect of the human psyche that has been exposed through all of this. President Donald Trump of the United States of America, all the way there, mentioned chloroquine, and there was a stampede a rush to get your hands on it in Nigeria, even though the federal government banned chloroquine, I believe in 2004, it's still been sold. People bought it, some people overdosed. Let's talk about this human instinct to just blindly follow what other people are doing.
It's unfortunate because if you, experts who have been advising have been saying, the chloroquine is being clinically, clinical trials, things are being tested. There's no actual information out saying, oh, take 2 tablets of chloroquine and coronavirus will go or something like that, So I think, but the unfortunate thing is this, which is what we're talking about, the psychology of pandemics. People want to hear that there's a kind of solution. There's some kind of solution so they can rush into it. I was in the supermarket like some days ago, and one lady was stepping out to one side shouting social distancing, and somebody on the left was telling her, just take two cupfuls of shekbe and you'll be okay, coronavirus will run. That kind of behavior. And the funny thing is that other person might actually consider going to take that shekbe. Meanwhile, it was just one stranger saying something. It's unfortunate, despite the fact that we're saying, hold on the chloroquine. I was at Channels and we were talking about how dangerous chloroquine is. If you remember not far back, the people who took chloroquine for malaria ended up with deafness, blindness, and they were actually sick taking chloroquine. So if we're taking chloroquine, people are rushing to take chloroquine for this. Meanwhile, there is no doctor that has told you take so amount of chloroquine. And from what I hear, it's the hydroxychloroquine that's even the drug, one of the drugs in the trial. No information has come out from the saying that takes so and so. But I mean, we're in a state of play. People will not hear. People will still do what they want to do. But all we can do is advise. For this pandemic to get out of control, it's all in our hands. If we want this pandemic to get out of control, let's disobey, do what we like, take the chloroquine, freak out, all that, and then the pandemic will get out of control. But if we calm down, calm down. Anyway, any system you normally use to calm yourself down, aside from drinking and smoking, because they're advising people now, no drinking, no smoking, no, lowering your immunity in any way, focus on, a healthy diet. Now it's become obvious that if you've been eating unhealthy all these years, here we are, you're suddenly, exposed to this kind of virus, you could get it, and it could get severe. So let's focus on, having a healthy diet, doing exercise, beef up your immunity, vitamin C, instead of the chloroquine drama. Go and take some vitamin C or fruits and beef up your immunity. That is better to me than going to swallow drugs that is actually even leading to chloroquine poisoning, from what we're hearing.
Thank you very much, Ada Osomonika there.
No, we're just going to take a short break.
Very educative.
Yes, but we'll take a short break and we'll be back with more with Ada Osomonika. Please stay with us.
Welcome back to the morning show here on Arise News. Still with us in our Lagos studio is Ada Osomonika, Chief Executive Officer of Midcare Health, who has been talking about the psychology of pandemics. Now, Ada Osomonika, we'll spend some time on a number of psychological issues. But let me ask you, what's your assessment of the efforts at containment made so far, first by the federal government, and second by various states? Do you think that there are some other steps that need to be taken? And if so, what are those steps?
So far, I think Lagos has stepped up. Lagos has. I can't really say too much of most of the other states because sometimes Lagos is what leads the pack. But Lagos has stepped up. But I still believe that there's more that we should do because we hear stories of people adapting. Not just like, let me give you an example. A flight coming in from the UK or the US, and then there's some people who are flying here and flying it to other countries so that they can come in from those countries. And still maybe even spread the virus. I think at the airport there should be stricter, in fact, as strict as possible, measures of these people coming into the country. Why are they coming into the country? We're talking about testing at the airport, but from the way I hear that the tests are done, it's not as simple as that, But if we work, like I saw a video today on a center somewhere in Edo State or Osun State where they do the testing for the coronavirus. I think if we pump a lot of more resources into such places so that we can create what you call a rapid kit test, something that it can be right there at the airport. I heard President Trump talking about them developing some kind of test that would be rapid, that would be you could actually swab yourself, and get results. So I think if we focus on getting, more effective, more, rapid testing, I think that would help. If we put these things at the airport, so as people are coming in, they're actually getting tested there and then, not just, oh, someone gets tested. It takes like 2 days or how many days from what we're hearing, before they get results. I think if we can focus resources and stuff into that to promote this testing thing and be able to get test results a lot quicker, I think that would help us. That would really help us.
What are your thoughts on a total lockdown? Boris Johnson of the United Kingdom has finally succumbed to those calls. He'd been resisting that for quite a while. And we have influential voices here in Nigeria, such as the First Lady, Aisha Buhari, calling for a total lockdown. Do you think that that's a good course of action?
What the countries abroad who are calling for total lockdown, I think they have a plan to even help support people while they're in the total lockdown in terms of finances, feeding, and stuff. Nigeria is a peculiar country. Total lockdown means you're on your own. How are you going to survive and stuff like that? Yes, I see her point, and I actually agree there should be a total lockdown so that we nip this thing in the bud. But we should also know that as we're calling for a total lockdown, what are the peculiar problems that face the average Nigerian who will be in lockdown? I was listening to a report from New York where they were calling out old cab drivers to come back and resume, work so that they could deliver food to the elderly. That is an approach to their peculiar problem. Here, if you ask for a total lockdown here, how are we going to support the businessman who gets his money on a daily basis? Yes, we can have total lockdown, but it shouldn't be just total lockdown, everybody go and fend for yourself. Total lockdown, what else can we do to help people while they're in lockdown?
That's very important.
Well, I mean, one of the things that I have observed, even here in Nigeria with the 40 cases we have, is that a lot of people are beginning to hoard things. They are stockpiling. They are buying, a lot of things with a lot of panic. I was in a supermarket yesterday. One gentleman had about 3 trolleys full of toilet paper. I had to ask him whether he's the only person, in the city of Lagos. What kind of advice will you give persons, who are beginning to hoard, who are panicking in the supermarket, buying things, even things that they do not need?
So the thread all over the world concerning this virus is that we are all in this together. And what does that mean? I have to be concerned about the person next to me. Now, if you're going to the supermarket and you're buying 5, 10 trolleys of things that could be useful to other people, as well. You don't necessarily need, maybe you're buying supplies that will last you a year. Let me say, just give that example. You're buying supplies that will last you a year. But this might not take a year. Other people will not even get access to those things. I think we should be a little more considerate and think about this in terms like, oh, it's not just about me and my family. It's about all of us as a nation. Because if there was a report about the young people going on spring break, feeling that, oh, they're young, the disease doesn't affect them that much, they can do what they like. And then a reporter had to tell a young girl that, okay, you'll be okay if you get the disease. But what happens to your grandparents or the elderly person that's near you or the person with a compromised immune system? What happens to that person? And the girl quickly thought that, oh my goodness, that she lives with her grandmother. She didn't even think about it before she went to the beach. So think about it this way, that, okay, see, I'm going in and I'm hoarding and I want to fill up my house with all kinds of food because I can. Why can't we do it this way? Okay, I'm going to buy what I need and what I know that can support me. What about the person, the person, people who can't even afford stuff. I heard Aliko Dangote Foundation is giving about 200 million things to do, you know, ambulances and stuff like that. Why can't we think in that manner? How do I help somebody else who's going to go through this kind of time, who we know clearly might not be able to afford the kind of stuff that we can afford? There's some people that are really, their own anxiety during this time is because they know that they can't, even if they wanted to stockpile, they can't, because they don't even have the funds to do so. So I think if we think more about each other and not ourselves, I think we'll be a bit better. The hoarding, I don't really support the hoarding. You can't go and buy stuff that's going to last you 6 months, you know, and then it's not going to be enough for other people. The reports are coming from abroad that, they're running out of medical equipment, they're running out of this, running out of that. Let's all be considerate, even as we are trying to look after ourselves. Let's think about the next person as well.
Indeed, but at a time of crisis is when you know what you're actually made of. Some people's instinct is to reach out and help other people, and some people, unfortunately, have the opposite instinct and they want to hoard. But what you said about the teenager on spring break, I mean, that's what the youth is about. Selfishness, feeling indestructible, short-sightedness. How do we begin to try and destroy this viral transmission without destroying the human spirit and people's liberties?
Okay, like when I was talking about the teenager, we're talking about an approach that parents could have to different, like if you have children that are teenagers, children that are the middle school, children that are young. Now, if I was handling this teenager who's full of life, who's full of, you know, vibrance and all that, I would have to explain to them why they can't. We're not telling you, we won't tell them you can't go to the beach or do what you like just because anybody's trying to cage you, but because they're trying to protect you and protect the people around you. So what can you do in the interim? While you're on lockdown, while you're in self-isolation, you can stay connected to because that's what's important to the teenagers and the young people. They want to stay connected to their own group of people. They want to stay connected to their friends. That's why they're shouting and saying they want to go to the beach, they still want to go out. Who wants to cage them in? No, but they can stay connected to these people through social media, through, you know, what they can create their WhatsApp groups. They can connect to each other on that level, you know, without, you know, coming out and you know, endangering the rest of us. The kids in middle school, one can engage them, explain to them what's happening, but also engage them in creative things where they're learning to do new things. You know, there's so many sites going up now about what kids can be studying online while you're home. You know, the youngest, maybe like if you have the very, very little children, parents, the funny about the little children is that they're very happy that finally mom and dad are home. I finally have mom and dad to myself, you know. So, you know, so what I'm saying is that we don't have to kill anybody's spirit. There's no need to kill anybody's spirit in this. It's explaining to those who need the explanation properly, you know, letting them know that this is what we have to do and this is why, you know, and it's not forever. This time, this too will pass. This time, I mean, there have been plagues before this, and there will be plagues and viruses even after this. But what we do in this time and space is extremely important to how we can beat this virus and plank the curve. Yeah.
Well, I mean, before we round up this conversation, what lessons do you think we can all learn so far from what is happening in the world with COVID-19?
There's one very big lesson I think I heard today saying that one of the things that COVID-19 is teaching us is that we are all human beings, whether we are rich, whether we're poor, whether we're high class, whether we're low class. This disease can take out anybody. You know, we are all actually human and we're all on this planet, you know, together. Another thing I think is teaching us as well is, especially in countries like ours, is that even if we've played for years over our healthcare system, now is not the time to play anymore. You know, in the States, they're building hospitals. They don't even have enough. They're building hospitals. What's to happen to us? You know, so I think those are some of the things we should learn. The things that we don't have in place now, let's begin to put things, you know, put those structures that we so lack, put them in place now, and understand that we're all human beings in this fight together.
The whole point, which goes back to the issue you raised about xenophobia, it's really the ultimate in folly because we really are in this together. I have to talk to you now about religion and the role that that plays. As we round up the conversation, that's very important because there's obviously been a restriction on religious services. Some churches and mosques did not observe that. Let's talk about religion and superstition.
Okay, religion, really. I've seen a lot of churches now go online, have their services, have their worship experience online, trying to, obey the government and everywhere. And I think we should do whatever we can, whatever the government says and whatever we can to help the situation. Have the online services that you need to have, because at this time too, let's not remove the spiritual aspect of things in terms of how you can, keep it together, having faith, being prayerful, being calm, and that is what religious institutions offer us. So I think we shouldn't focus on the superstition. There's so much superstition. Yeah, I heard today that Idris Alba was saying that people should stop saying that black people don't get this disease because he got it. So some of this information that we've been spreading around, superstition about the virus, we are all learning at the same time. Things are evolving right now. We're all learning together what this virus can and cannot do. The religious aspect, we should focus on the positives that we get, the encouragement that you get from your pastor or your imam or wherever it is that you worship. You can stay connected to your church or your mosque, wherever, But now it's become apparent that we have to have untraditional means of staying connected.
I mean, it's good that you say faith is important and that religious institutions have a role to play. But what do you think of persons who say at this time what they need is anointing oil and holy water as a solution to COVID-19?
Wow, anointing oil and holy water. I don't know what led to that or what led to that conclusion, but I know one thing, that God himself is a wise, the Lord that we worship is a wise God altogether. I don't think to say, oh, I'm just going to pour anointing oil on myself and I'm going to be all right. I don't know. I don't know what led to that kind of belief, But, I don't know what led to that kind of belief. But truly, what I believe at this time is, hook up to God and just stay focused, stay positive, look forward. That's what I'm
Very much, Osomonika, for coming to the morning show. Thank you very much indeed.